Okay, so same drill as usual. We'll go through the surveillance report. We've got Kallie and Tracy on board today. I'll throw it to them, and then we'll take some questions if that's okay with everybody. Y'all still hear me okay?
Yep.
Okay. All right, so here's our weekly surveillance report. You've probably been watching the daily numbers, and so it's not going to be a shock to you that we continue to see an increase. Our 7-day rolling average daily cases is now approaching 50. We're at 49.3 per 100,000. That's an increase over last week, just a kind of a continued slow escalation, but that we're getting significantly above that 25 cases per 100,000. That is kind of the threshold you want to be under in order to think about doing some other things like opening up businesses and that kind of thing. So now, there could be a lot going on here. We're seeing, this does coincide with timing of people coming back from spring break. We're probably seeing some things related to that. I'll tell you, we continue to see some evidence that people are like letting down their guard a little bit. We're investigating some complaints on some activity in a bar or two, where we're seeing crowds of people, or at least initial evidence of crowds of people that go way above and beyond what's allowed in the local emergency rules. So we're looking into that. I think that generally people are tired. People are letting their guard down a little bit. The other thing we're seeing is about over half of our cases between April 2nd and April 8th, 54% to be precise, are between the ages of 20 and 39. So we'll see that reflected in some of the data here in a minute. Our positivity rate is also going up. You'll see this curve is a little different than the last time we showed it to you last week. That's because we got some lagging information from Big Sky. Some of the Big Sky surveillance report testing reports were late coming in. And so when we factored those in, it pulled the curve down a little bit, but you can see we're still edging up above 11%. You really want to be below 5%. And once you start getting above 10%, you really start to be worried about the positivity rate being at a point where we're seeing more uncontrolled spread. Again, this isn't skyrocketing, but it's been a gradual inclines through the first late March and the first days of April. Testing, this is again, our testing is in good shape. These outlying days here, that's a reflection of some of the late arriving Big Sky testing that came in. Now the good news there is that testing was happening and the positives were getting followed up on like they usually are in Big Sky. It just was a lag in that data hitting our system. That showed one artifact of that is it showed some of these days with a really significant number of days between the test results and report to public health. That's just because of the Big Sky testing. Generally speaking, we continue to see testing turnaround times in pretty good shape. We're getting them back in a day or two. And these outliers are really related to that Big Sky surveillance coming in a little bit late. That's also reflected that this chart, the number of days from specimen collection to date received by public health. You can remember, if you recall, we rarely have large bars on the 5, 6, and 7 days out. That this is a reflection of the Big Sky lag. Again, we're doing pretty good in our contact tracing. We have been forced to go into streamlined contact tracing because of the number of cases we have combined with the amount of vaccine we're getting out. We continue to do contact tracing and get cases and close contacts isolated or quarantined. We just aren't able to go as extensively into those case investigations with the number of cases we're having. When we're pushing 20 or 50 cases a day, along with the burden that we have to get the vaccine out there, that's testing our human resources. Here you can see the onset date, and then here you can see the the uptick that we're seeing, particularly in people who are in their 20s, really is taking off again, as we saw it happen in early October. That's significant, and that combined with some of the complaints we're seeing coming out of some of the activity in the bars is also concerning, and also some anecdotal reports about gatherings that are happening outside the bars. We're seeing people come together, and that's concerning because we're seeing a number of cases. The good news is we haven't seen that migrate into the hospital settings yet. Our hospital census remains in good shape. I'm sure Kallie's going to talk about that in a minute. We continue to have low single digits in the hospital that are infected with COVID. And we haven't seen a lot of cases in our long-term care facilities. So we're going to continue to watch that. We definitely don't want to see those case numbers high for long periods of time, because eventually, those cases will migrate in. But so far we're doing okay with the long-term care and the hospital number hospitalized. At MSU, we had 45 new cases during the most recent reporting period. That's pretty similar to what we had last week. And the number of active cases is holding fairly steady compared to where we've been down a little bit from last week. You can see here, we continue to get school cases. I do want to caution you, this Emily Dickinson number, the reason I was late is we were doing a little bit of detective work on that. We think this number is incorrect. We think that number is going to be lower. We're trying to reconcile. We think there may be some a group of cases that may have been double counted there. So we'll get that corrected. I don't want you jumping to conclusions with this Emily Dickinson. We're working with BSD7 to really understand what we got there. We do have some cases. We think it's more like 5 or 6 cases at Emily Dickinson right now. But we'll look at that, we'll correct it, and we'll get that back up on the website. I just want you to be aware of that. We are seeing cases in schools. Generally speaking, when we're working with like Bozeman schools, they really watch their cases closely. I was just talking to their staff. They had some of their best days, some of their best weeks of the year were going into spring break and then during spring break. And then since spring break has ended, they've seen a rise in the number of cases, as we've seen in the community as well. Critical care beds at the hospital. I'm going to let Kallie talk about that. In fact, why don't I just throw it to you, Kallie, now? You could probably do a better job talking about where we are at Bozeman Health right now.
Sure. Do you want me to give my full update or just talk about bed capacity?
No, that'd be fine. Full update's great.
Full update. All right. Thank you. Hi, everyone. I'm Kallie. I'm Bozeman Health Incident Command Lead. I do have just a quick short update, and then I'll talk about hospital census here. To date, we've administered over 11,000 first doses and almost 8,000 second doses to our patients and others in the community. This week, it was our first week of administering over 3,000 first doses at our Deaconess Hospital location. And we were absolutely thrilled that everything went well, which was according to the overall feedback we received from our patients and our staff who were serving in that clinic, in those clinic days. Our vaccine appointment sign-up links are all on our website for Deaconess Hospital, as well as for Big Sky Medical Center. So you can go to bozemanhealth.org, and on the top, you'll see a blue bar, and it says, click here for vaccine information. And then if you scroll down a ways on the website, you'll see that there are specific clinic dates listed, and you can click on one that's convenient for you and register for a time that's available on that clinic date. We continue to receive allocated vaccine in specific amounts for first and second doses. So I want to call a little bit of attention to that to let you know that it's very important that all current Bozeman Health vaccine clinics that are on our website are specifically for people seeking first dose vaccine administration. And at the time of their appointment, then they'll be scheduled for their second dose. But all residents need to return to the location where they received their first dose in order to receive their second dose. At this time, due to how we receive the vaccine allotments for both the first dose and the second doses, we are unable to accommodate those who just need a second dose. So once again, I'll reiterate that those clinic dates on our website are for first dose only. And then we schedule them for their second dose once they have completed their first dose. And then I'll move into bed capacity now. I know you showed that briefly, Matt, but as of right now, we have 60% of our critical care beds occupied and 62% of our non-critical care beds occupied. So we're sitting very well for our hospital census. And then, you know, as always, we work very closely with our partners on this call, and we really appreciate everything they're doing to work to get this community vaccinated. So thank you.
Tracy, there's a lot going on at MSU. You guys have been working hard. You want to give people an update?
We're continue to focus on vaccinating students, and we're very grateful to the help we get from Gallatin County in terms of an allocation of vaccines for those students. So far, when we open up a clinic for students, it fills up right away. And we've gone to 2,600 total first doses, of which 2,000 of those are also second doses. And so we'll continue to march along next week.
Thanks, Tracy. I just want to, Kallie's presentation reminded me to talk about how we're, the process that we're using at the county as well. As you all remember, last week, we switched to a system where people can go to our website, healthygallatin.org. They can sign up on and basically it's a notice of interest in vaccination. We really want anybody out there who can't get a vaccine, who wants a vaccine, to be going in and signing up. That helps us plan. It helps us build staffing, and it helps us allocate vaccine in a way to where it needs to go. It is really encouraging in some ways that we are getting enough vaccine now that Bozeman Health has slots available. You can go on their website and you can sign up. We continue to, so far we've had just over 12,200 people have signed up, given us their notice of intent to vaccinate on our website. Of that number, we've been able to invite just over 7,600 people as of today. That's about 62% of the people who have told us they're interested in the vaccine. Still about 4,600 on the list, but at this rate, we'll be moving through that pretty quickly in the days and weeks ahead. It's really important when people are trying to get vaccinated that they can go to the Bozeman Health site and get one of those slots. They can go to our site and they can sign up for that notice of that notice of intent to vaccinate, and we can get them on the list, invite them to one of our county pods. We also share that information with our partners when they have clinics that are not full. We can go to that list and invite people in to get vaccinated at those sites. So it's really important. It's helpful to us. We really want people to go in there and tell us that they're interested. And we want people to really take advantage of the opportunity to get their vaccine now. We have systems built. We are getting vaccine. We have systems built in order to administer that vaccine. And so we want to make sure we take advantage of that. Those systems, we can't keep them around forever. We're going to keep them around as long as we have to, but it really helps if we can concentrate when people are looking for this vaccine. You know, we're seeing our weekly allocation go above 4,000 and even 5,000 first doses a week. I really want to express appreciation to the state health department for working hard to get us that vaccine, and all our partners, Bozeman Health, MSU, community health partners across the board have been really bending over backwards to increase their capacity. Next week at the fairgrounds, we'll have 5 pods. Every day of the week, we'll be giving shots either in a first dose clinic or a second dose clinic. We'll also be working with the Veterans Administration one of those days to provide vaccines for VA patients. So with that, I think I'll open it up to any questions that are out there. So anybody have any questions?
Matt, I did want to make one quick clarification that I forgot to mention in my update, which was that anyone can go to our website. You do not have to be an established Bozeman Health patient. We do know who our patients are, and we are proactively sending messages to them, encouraging them to sign up. But we also will open up to additional people who are not registered as patients at Bozeman Health.
Sorry about my phone, Kallie, and others. It doesn't stop going off, and when I forget to mute it, it bothers me. So I just did that. I apologize for the noise in the background. Okay, questions?
Hey, Matt, Nora with the Chronicle here.
Hi, Nora.
Hey, I have two questions. I guess I'm wondering, first of all, for the people on the waiting list who have been able to sign up for an appointment, do you have any numbers on the uptake, I guess, from people who are already on the list who then get invited to a clinic?
I don't have those at my finger. I mean, it's, you know, I would assume if they're going on the list and they're saying they want a vaccine, 100% of them really want the vaccine. Now, some of them may end up getting shots somewhere else. So I don't know if anybody is listening in from our response team has that information. Otherwise, we can look into it. I would say that we're moving through that list. We're giving people 24 hours, then we're moving to the next set of invites. People can come back and tell us that they still want it. I don't have that uptake number for you, but we can look into that if you're interested in it.
Hey, Matt, this is Bob Fry.
Hey, Bob.
Hey, just to give you an example, I mean, if you think about how many people signed up the first couple of days, it was about 7,000. We've already went through all those. That was just last week. So it's a pretty fast turnover in how fast we're going through that list. That help?
Okay. Yes, it does. Thank you. And I guess I'm also wondering with that, I don't have it right in my notes there, but the 12,000 number, is that about what you expected, or did you have a number in mind of what that waiting list would look like?
You know, I think it's in the ballpark of what we expected. We were talking the day that we put it up there. I think one member of our team was guessing about 5,000 that first day, and that's kind of what we hit.
That was me.
Yeah, it was Bob. Bob's taking credit for that. Bob's our incident commander, and so he is taking credit for that many times.
I won the pool.
Yeah, but I do think it continues to grow. We expect that. I would expect that if we keep seeing cases, we know when we see hospitalizations pick up, human nature is people tend to take action. And so we're watching that pretty closely. We really do need people not to wait, though. If they want a vaccine, let us know by going on the website and letting us know so we can plan for that.
Okay. And the last thing I was wondering, you mentioned, I think it was 2 bars that you had received some complaints about. I'm wondering like what official action is being taken, and if you could share which establishments those are.
Probably next week. We're asking, sometimes we get complaints and we have to verify the information that's coming in. And that's the process that we're going through right now. I don't really want to share the names of the bars right now until we go through that process and really understand what is factually accurate and what is not. But we'll make those available next week, and as well as the communications that we have. It may be letters of warning. It may be just informal consultation with those folks. I've been in touch with the Bozeman Police Department. And frankly, anybody can walk up and can walk up and down Main Street, can go around the community and kind of see what's going on inside those establishments. A lot of them are really working hard to follow the rules. We have gotten some complaints that there are some that are not.
Okay, thank you.
Yeah.
Hey, Matt. Sorry. Who wants to go?
Aaron, did you have a question?
Yeah. So you kind of touched on it already. It sounds like Gallatin County isn't quite there yet, but I'm hearing across the state that there is a bit of a softening of demand for COVID vaccines. And it sounds like it's going to be a matter of time before you work through that list of interest. And I've been hearing a lot of other counties talk about these vaccine maybe people or vaccine complacent people that are waiting not going out of their way to get the vaccine. I mean, do you imagine that Gallatin County will be moving on to focus on some of those groups in the near future?
Absolutely. We've already started talking about, getting to populations that are being underserved, or that, for instance, the population of 16 to 20 years old, that in school settings, we've seen some pretty significant disease transmission in schools at times, especially related to athletic teams. At least anecdotally, we've seen that. And so making those vaccines available to those who want it. I want to be clear about that. This is about making vaccine available to those who want it. This isn't about compelling anybody to get the vaccine in any of these settings at this point in time, but we'll definitely be reaching out in different ways. We're also talking to amongst ourselves and with the state about ways we might do outreach in environments that we typically wouldn't be doing, where we want to get at populations. And so, we really were focused on that highly vulnerable population, and we still are. We want to get those people who are in their 60s, 70s, 80s and up. We want to get those people with those underlying health conditions, people who are living in settings where disease transmission can have greater impact. But as we move through this, will allow us with more vaccine supply and maybe a little bit of everybody we give a shot to is somebody who's not in competition for that vaccine. As we move through that, it allows us to move into populations where we're seeing transmission happening, where we're seeing people who are in their 20s and 30s getting vaccine into settings where those people tend to congregate, making it easy for them to get the shot, potentially making that Johnson & Johnson vaccine available because it's only one dose. We can get it into them quicker and we don't have to follow up with them. So we'll definitely be doing that in the days, weeks, and months ahead.
And just one quick follow-up. I mean, at the rate that Gallatin County is going and knowing the kind of the size of the list of people who definitely want to get vaccinated, I mean, do you think it's going to be difficult for the county to reach that kind of 70-ish% mark for vaccination?
Yeah, I think it's going to be difficult for the entire country, for the state, and for Gallatin County to get to that 70% mark. And I'm not saying we can't do it. I'm not saying it's impossible. I'm just saying it's a lot of hard work, and it's been hard to get to deal with the demand, but we're used to it in public health. We deal with that in the influenza vaccine every year. In a good year, we've got 50% of the population willing to get the influenza vaccine. We're used to that work. That will just be continued ongoing efforts to reach out to people and make it easy for people to get that vaccine.
And then, sorry, last question. I've been hearing a lot of county health officials and community health centers talk about point of care offerings for vaccines, trying to reach those vaccine, maybe people, especially with the Johnson & Johnson, if they're in there for something else and they're offered, the J&J shot, they'd probably likely take it. Is that going to be a big focus to try to get that middle ground group?
Yeah, those Johnson & Johnson shots are really valuable that way because you can get them into settings where people are difficult to follow up. MSU is one example. They're getting close to the end of their term. You give somebody a 2-dose shot now, by the time you get to the time for their second dose, they're going to be out of session. And so using the Johnson & Johnson vaccine in that environment makes a lot of sense. We saw community health partners using it at the warming center with HRDC, with a population that sometimes is hard to reconnect with once you connect the first time. And we know that there's people who need the shot in order to be able to go visit loved ones in certain settings, and we're trying to do that. So, that Johnson & Johnson vaccine is really valuable that way, and we're trying to direct it in ways that we can get the most bang for our vaccine buck there. But we're also aware that it looks like national supplies may be disrupted a little bit. We're not seeing that here. We continue to get that vaccine, and we continue to share it out there strategically so that we're getting it to people who are more likely to get shots because of that, because it's that type of vaccine.
Thanks.
Yeah, good questions. Thanks.
Hey, Matt, this is Emma with NBC Montana.
Hi, Emma.
So a couple questions kind of going off what you just talked about a little bit. I've seen some other counties like Butte Silverbow have actually announced that they will be adjusting their clinic hours to try and get some of those younger people in. That's kind of 16 to 20 age range from other counties who aren't able to get vaccines. I was wondering if you knew anything about that, or kind of had any comments on some surrounding counties trying to get that population from other counties to come in to travel over to get their vaccine.
Yeah, I mean, if counties are doing that, I have no problem with it. I want to be able to get people to be able to get their shots here. That's the ultimate goal. I think that's really valuable, especially with the 2-dose vaccine. It makes it way easier for people. So we're going to keep working hard at that. As far as the alternative hours, we're looking at a number of ways. We're looking at both with our own operations, but also with some of these independent private providers who may want to come in and do those sorts of clinics. We think that's a good idea. We'll probably be looking more at that. Again, we're not at the point where we don't have anybody to give shots to. We still have our clinics, our county point of dispensing clinics are filling quickly. We're looking ahead to that point in time when maybe we'll have a hard time filling those clinics, and how we get to people in different ways. We'll absolutely be looking at not only alternative times, but alternative venues to be able to make it easy for people.
Great. And so I know you mentioned, obviously, the dose allocation in the county has increased a lot. I believe last week you said it was around 4,500, but this week it's gone up a little bit more. Did you have any more numbers on that, on how much it's increased?
I don't. I can get that for you. I didn't see what that was this week. That usually is like a late Thursday thing, but we can look at that. And at the very latest, early next week, we can let you know what that settled out to be.
Yeah, it was a little over 5,000, I think.
Great.
Up at 5,100.
Thanks, Bob.
Great. And has it been, I mean, obviously you've talked a little bit about that it's been helpful, but has it been helpful to see that go up? I mean, just a couple weeks ago, we were still down at like 1,800 to 2,000, and now we're all the way up above 5,000.
Yeah, the biggest thing it lets us do is it lets us get it out there to other partners in the community. I mean, MSU is one example where a couple of weeks ago, we just didn't have enough vaccine to go around. They were very eager to get it and to offer it to their students and their staff. That's one example. There's other examples. We're reaching out to school districts. We're reaching out to other partners. So that's the big thing it does. Our county point of dispensing, the point of dispensing at the hospital. Maybe Kallie, you want to talk about the difference the additional vaccine has made. But those, we have really worked to beef up staffing in different ways, bringing the National Guard in, bringing some contracted services in. But that only goes so far. So having those community partners out there, the VA, community health partners, the private pharmacies, the Walmarts, that's really important too. I don't know if you have anything to add to that, Kallie.
So we've been working with the National Guard. They're here helping us with entrance screening and with navigating, helping patients navigate our system, and they're doing an excellent job assisting us. But we have an entire hospital and clinic setting that requires large operations as well, and so we're working as nimbly as we can to flex to meet the demands of those high volume administrations. And we know it's so important for community health in general. So we're proud to be doing that, but resources are not unlimited.
Yeah, I mean, I just want to take a minute to thank everybody on the health department team, the incident command team, the folks at Bozeman Health who have been running test sites, have been running the viral triage clinic, same at Montana State, serving, running a full-time student health center as well as a test site, and now giving out those vaccines. Community health partners going in, working with HRDC to go into the warming shelter and really do some aggressive outreach to some of our hardest to reach and sometimes most underserved populations. Chief Grube down in West Yellowstone. I just can't speak highly enough of the work that he's been doing to make vaccine available to people in what is really our most isolated community. And Big Sky too, the work that's been going on by Bozeman Health, as well as some of the community partners up there in Big Sky. our work isn't done. I just want to take a minute to really recognize those organizations and the people who are working there, because it's hard work. But it's happening and we're getting vaccine out there. So I want to thank them.
Great. Awesome. So just last thing, with the increase in cases we've seen the past couple weeks, and this rise that seems to kind of only be happening in Gallatin County, is there any little bit of feeling that this is kind of a rehash of what happened last spring?
I mean, absolutely. It has reminded me of last spring when Gallatin County was seeing more cases than anybody else for a significant period of time. The big difference between then and now, though, is we have vaccine. And so we just don't know, we're hopeful that we can continue to see a low number of people in the hospital, a low number of cases in long-term care facilities. But we need people to get vaccinated, and we need people to take this seriously. We are seeing a rise. I think this is a little bit of a surge that we're seeing here, and I hope it doesn't grow into a larger one. We need people to understand that we're not done with this, that this virus continues to circulate. We continue to see variant strains of it. People continue to be sick with it, and some people continue to get really seriously ill. And what you can do to protect yourself and do to protect your community is make an appointment to get a shot as soon as one is available. We really want people to be out there getting shots, and then continue to do that social distancing. We can't, if we're busting our chops to give people shots, but we've got, people shoulder to shoulder and jowl to jowl in bars, that is working against the tide. We really need people to continue that social distancing, to continue to wear those face coverings in public while we give these shots out. And hopefully if we can do that, we'll be headed to a more normal summer.
Perfect. Thanks so much, Matt.
Yeah. Other questions?
Matt, I just wanted to make sure, it's Noah Schmick, ABC Fox Montana. I came in a little bit late, so I just wanted to make sure you may have hit on this, and so I could go back and watch the recording. But I saw Emily Dickinson had 16 new active cases. Did you hit?
I did hit on that. We think that number might be wrong, Noah. So
okay,
hang tight. We're reconciling that. That's why I was a little late for this call, because we wanted to make sure that we were on track with that, and we're working with BSD7. So I don't think we have 16 cases in MLE, and we'll be working to correct that. So if you could all kind of help us with managing the flow of information on that, that would be helpful.
Okay, that's fine. Just want to make sure. And then are we still seeing the uptick in just the 20 to 29 range from, I asked you that last week, so that's fine.
Yeah, so, of the cases that we had from April 2nd to April 8th, the rough calculation that we did this morning was about 54% of them are between the ages of 20 and 39. And you'll see in our surveillance report that uptick in that, especially people in their 20s category. Yeah, that age decade is definitely helping to drive what's going on here locally.
Perfect, thank you.
Aaron with Montana Public Radio again. Just wanted to follow up on, do we know how much of a role variants are playing in this increase? And then kind of following up, with these variants being more infectious, coming with a higher R value, is that going to make kind of the bar for herd immunity a little bit higher as well if they definitely gain some prevalence?
I haven't seen enough data, Aaron, to really say unequivocally that this is being driven by variants, but it needs to inform how we move ahead with this. And frankly, the advice that we give to people is, we know the variants are here. We don't know if all of them are here, but all of them will probably make it here. So we should assume that. We should assume that some of those are more transmissible. And that's why it's really important that people continue to wear those face coverings, continue to get vaccinated when they can, and keep social distancing. So, I don't know that I have the data to be able to say unequivocally this is being driven by variants. We'll keep working with the state. We'll keep looking at those numbers. But frankly, even if we knew that, our advice to people would be continue to be the same. Keep that social distancing going, wear those face coverings when you can't, and get a shot when you can. All right. That was a lot of good questions today. Anything else? Okay. Thank you all. Enjoy the sunshine today and have a nice weekend.
Thanks, Matt. You too.
Thank you, Matt.